The Education Secretary Gavin Williamson says the government's approach to reopening schools in England will be cautious and based on scientific advice. But he warned that the longer schools are closed, the more children will miss out. It comes after teaching unions expressed concerns over plans for some pupils to return to schools in England from the 1st of June. A further 468 deaths of people who tested positive for coronavirus in the UK were reported in the past 24 hours, taking the official death toll to 34,466. With more, our education editor Branwen Jeffries.
Classrooms empty now in England, but in 2 weeks' time, a few children are due back. Some teachers and parents remain fearful. Today, the government said it was the right decision.
There are some who would like to delay the wider opening of schools.
School governors will be involved in the plans, so I asked how they should weigh it up. They are going to be thinking about their legal responsibilities in terms of making each school safe. How are they meant to reconcile that conflicting advice they're getting from you and from local councils?
What we would ask them to do is look at the guidance very, very carefully and recognise the fact that we are there to provide the very best for every single child who goes to that school. And the best way of doing that, the best way of protecting children, the best way of giving them the best opportunities in life is actually to have them coming back into school.
Schools are getting ready as best they can, changing classrooms, contacting families. Parents will choose whether to send their children, and some think it's time to start going back.
I'm not kind of waving a flag saying let's go back to school and put 30 children in a class and have it as a normal school day. I think there needs to be some kind of schooling in terms of some kind of non-physical contact at school.
Ministers point to Denmark, where children began their return a month ago. But today, teachers' unions here raised concerns. Too many cases, too little testing, among their 5 priorities.
We really want to get schools back open again as soon as it's safe to do so. We've got 5 simple tests that the British Medical Association on Friday told us they agreed with our tests. And we think the government hasn't yet met them. But they are not obstructive tests. They are tests that are to encourage the government to meet them so that we can get back to school. We're not there yet, though.
The gradual return to school remains a hope. The scientific evidence remains under review. A final judgment in England at the end of the month, as schools in the rest of the UK remain closed. Branwen Jeffries, BBC News.
So, as ministers insist they will be led by the science when making these decisions, what does the science say about how children are affected? Lauren Moss explains.
We've only known about COVID-19 for under 6 months, and the science community is still learning about it. But one of the big questions to answer is how are children affected? Put simply, children seem to catch coronavirus as much as anyone else. The survey by the Office for National Statistics published this week suggests 1 in 400 people in England has coronavirus, and it also found that children are just as likely to test positive as adults. But they don't appear to develop symptoms which are as serious or be as vulnerable to it. More than 24,000 people have died in hospitals in England with COVID-19. 12 were under the age of 19. Most had underlying health conditions.
We know from the current information that children have fewer symptoms and appear to have different transmission dynamics to adults. And it looks like they probably have shorter or fewer viral excretions from coughing and speaking. But we can't be sure for certain, and we certainly need more research in the area.
So if children catch coronavirus, how likely is it then that they can carry it and also spread it? Any increase in social mixing could lead to an increase in the R number, the rate of transmission. Children are super spreaders of other diseases like flu, but we just don't know how infectious they could be if they have little or no symptoms.
There is the possibility, although it seems slight, that children might transmit it to other children or to staff members. But again, what evidence we have suggests that doesn't happen very much. But opening schools does create schools as being a social hub. That is where teachers will meet other teachers, will meet parents, so there will be increased mixing, and so there could be some spreading as a result of that.
It's early days as we begin to take steps to emerge from the lockdown. What we learn in the weeks and months ahead will shape what our new normal becomes. Lauren Moss, BBC News.
Well, our political correspondent Jonathan Blake is here, and tonight, Jonathan, the Prime Minister is trying to address some of these worries, including schools reopening, but these wider worries around this easing of lockdown.
Yes, the difficulties around reopening schools in England is just one part of a painstaking process the government's involved in trying to ease the restrictions put in place in England safely. And Boris Johnson has said he understands people's frustrations. Writing in tomorrow's Mail on Sunday, he says we're trying to do something that has never had to be done before, moving the country out of a full lockdown in a way which is safe. And he goes on to say, I recognise what we're now asking is more complex than simply asking people to stay at home, which of course was the message before, but he says this is a complex problem. Now, the one thing that would solve that problem, of course, remains the development of a successful vaccine against coronavirus. The Prime Minister claims the UK is leading the global effort in those attempts. He's announced the speeding up of the opening of a new manufacturing and innovation centre which would make and distribute a vaccine in the UK if one were to be developed. That remains a big if. As the Prime Minister himself says, I must be frank, a vaccine might not come to fruition. And in another reality check reminds us that we may need to live with this virus for some time to come.
All right, Jonathan, thank you.